everyone, and welcome to our Care Patrol Fireside Chat. My name is Becky Bongiovanni. I'm the brand president of Care Patrol. You know, last week, Argentum, the National Association for Senior Living, has reported that 4.4 million doses of COVID-19 vaccine have been distributed for use in long-term care facilities. And on average, 137,000 doses of the vaccine are being distributed for use by this sector each day. Previously, the CDC estimated that a total of 3 million people needing vaccines within this sector and such have already distributed 146% of the doses needed for skilled nursing facilities, assisted living facilities, and other long-term care facilities. So this is really great news for all of us who work in long-term care. And I know there's a lot of questions and a lot of confusion when it comes to the vaccine and how it affects you or your loved one. And so with us today, I've invited Kinsey McManus, who's the program director of the Alzheimer's Association Desert Southwest chapter. And the Alzheimer's Association is the largest private funder of Alzheimer's research and the premier source of information and support for more than 5 million Americans with Alzheimer's disease and other dementia related illnesses. And there are 15 million families and caregivers. So Kinsey, I'd like to have you introduce yourself and tell us a little bit about what you've been working on.
Thank you so much, Beck. And I'm truly honored to be able to speak today on this topic. So I will say, as many of you know, our long-term care settings have really been an epicenter for COVID-19. So we are in strong support and are very pleased the Centers for Disease Control and Prevention have decided to prioritize residents and staff of nursing homes and other long-term care settings for receiving vaccines. We really need our vaccines to begin with our most vulnerable and where the threat is the greatest. We believe that vaccines are an important step in protecting the health and safety of long-term care residents and staff, and we strongly encourage their use. The reality is that we have seen many of loved ones decline with dementia as a result of months upon months separation. And vaccinating residents and staff in these settings is a critical step to allowing residents to reunite with their families after these months of separation.
Yeah, thank you, Kinsey. It's been such a year with 2020 and everything that families have been going through. So we are excited that the vaccine is here. And I'd like to ask you some questions from your perspective and the Alzheimer's Association perspective that I think most people are asking right now. And so we could get some real-time answers on. So first, I would just like to say, are vaccines safe for people living with Alzheimer's dementia?
So currently, the FDA, the Food and Drug Administration, has approved 2 vaccines, one through Pfizer and one through Moderna. So as a part of getting that approval, they had to go through clinical trials that were very large and included, testing the safety standards for people across different races, different ages and ethnicities, as well as different medical conditions. If you're concerned about the safety of vaccines, it's so important to talk to your healthcare provider. And I know part of this too that we heard, especially as a part of the rollout specifically of the Pfizer vaccine, is that people with really severe allergies, some have had some more significant reactions to the Pfizer vaccine. I do want to be clear that none of the complications were life-threatening, but this is something that, you want to take the time with to decide. If your loved one or you yourself or someone with very severe allergies, take the time, talk to your physician or your most trusted healthcare provider to make the decision you feel is the most safe. Help you some of the research around what makes sense, what you should be considering. How do you make sure that you ensure the safety for yourself when you're getting the vaccine. If you have severe allergies, there may be recommendations your physician can make to help mitigate those issues, or at least be prepared should that happen in the rare circumstance.
That's really great advice. So if a loved one with dementia is in assisted living, how does the family make sure that they get or do not get the vaccine? And what if the loved one is unable to consent as well?
Sure. So I think my general recommendation overall is connect with the long-term care setting, if it's the director of the community or the director of nursing, and talk to them about what their rollout plan is internally. It's really important to know what their process is and what their mindset is. So included in that, they'll also be able to help you in addressing specifically what happens if your loved one does or does not want to have the vaccine. I do want to be clear, the vaccine is not mandated. People do not have to take it. While we at the association strongly recommend getting the vaccine, it is not a requirement. And that's something also to think about with the staff of the long-term care facilities as well, in the settings, different community settings. They're also not mandated to get the vaccine. So again, it's really connecting with someone in their leadership at the community setting to find out what is their plan? Are they doing something specific around it? If the loved one cannot give consent, which is a great question, right? That should really be coming from the healthcare provider contacting either the loved one's power of attorney or the identified family member who is permitted to make, legally permitted to make medical decisions for the loved one. What absolutely needs to happen, and this is a part of the process more generally, is that there still needs to be access to personal protective equipment, rapid testing, and other security measures and safety measures that wherever your loved one is currently residing, that they're ensuring the safety of all. Because the reality is that not everyone may get the vaccine where your loved one lives, and that includes fellow residents as well as some of the staff. So it's critically important to ask the serious questions around how are they going to handle that? What does that mean? How does that change the process for how everyone's living together, and for the staff who are working there as well?
So if someone does not want to take the vaccine, what is it that they need to do?
So first and foremost, if they have the capability of consent, they can literally talk to the staff in whatever care setting they're in, whatever community they're in, to say, I will not be taking the vaccine. It should be a relatively simple process of stating that you're not interested in taking the vaccine. And if you choose not to take the vaccine at this time, it doesn't mean that there wouldn't be opportunities later down the road where if you change your mind, to make sure that you still can get access to the vaccine. Again, it's really about how is the community distributing vaccines? What is their plan? So if you're someone choosing at that time to not take the vaccine, make sure that you're connecting with the correct person to inform them that you will not be taking the vaccine. You may need to sign paperwork. If there's any paperwork associated with that, it would be really important to ask. And as well as what the opportunity could be in the future, should you decide that you do in fact want to get the vaccine further down the road, what those possibilities and options are. And then for family members who may be the power of attorney or the identified medical decision maker in the family, again, it's connecting, probably to director of nursing or whoever is heading the rollout of the distribution plan within the community setting to determine what processes you may need to take. And again, it's so important because things are changing regularly. Some people may be nervous about taking the vaccine right away and are interested in waiting to see how it goes. as more community members are vaccinated, as more people in the country are vaccinated. And again, it's working with your healthcare provider to make sure that you're making the best decision, but to make sure that if you're currently not comfortable with getting the vaccine, that you have a backup of how you could get it should you decline in the moment where it's currently offered. It's very easy for us in the general public, because no matter where you are in the priority line, you can always go and get the vaccine later on while they're still mass distributing. But for loved ones in supportive care or community care, you really want to make sure that you know what the alternatives are should the decision change. So
Yeah.
thanks for asking.
Yeah, absolutely. So, another question I think people want to know is, well, I know if I'm going to get the vaccine, or, my loved one is, but what about the people that work at the long-term care communities? How will I find out what their vaccination plan is for their employees?
So this is something, and again, I think we're going to see probably some rules change around this as distribution for our frontline workers and our healthcare staff are getting vaccinated. I suspect right now, my understanding is that you should be able to contact the person leading up the distribution plan for that location to find out what their protocols are for staff. I don't think there will ever be a time where they will be permitted, because it's protected health information, which have or not been permitted. They may be permitted to give you a percentage. Certainly, if your loved one is residing in the care facility or the care setting, they're probably going to be required to disclose percentage of vaccinations. I would assume, again, I'm talking now a little bit into the world of unknown. I do suspect, as we saw with some of the other rules and regulations around access to information for COVID, we saw states and municipalities step in to make sure that our care facilities were being transparent about what their processes were around ensuring safety and security of our loved ones. And I think that this really falls into that as well. I mean, again, this is an area that gets a little bit gray because it's protected health information. So again, it's so important to be in regular contact with the person overseeing the distribution process, or whoever the organization determines is the person for families to interface with, to make sure that you're getting ongoing information, even once your loved one has been vaccinated or chosen not to be vaccinated, to just know how things are going.
Yeah, I agree. And I will say that, when you're working with someone at Care Patrol, they can actually let you know ahead of time, even before you visit the communities, what their policies are. So that way, if that's an important decision to you on, are they requiring their employees to be vaccinated or not, or if it's something that, they can share, at least you can get that information. So Kinsey, what's the timeline for the vaccines, and who's giving them?
So I wish I could wave a magic wand and be able to tell you that this was a really easy answer to share. The reality is that each state has been given the responsibility to determine their distribution plan across the state. Now, generally, everyone is following those guidelines from the CDC of who are the priority groups and when people get access to the vaccine. But the rollout, state to state, county to county, even within a state, can look very different. So I will say my recommendation is, learn your state's overarching plan, but then to really know what's happening, most likely it's going to be at your county public health department level. So they're going to be a great wealth of information of what, like right now, right where you're at, what is the access, what does the distribution look like? We've seen that some states have been much more aggressive in the initial rollout than others. Some states are reporting that they didn't get the volume of vaccines they had anticipated when they developed their rollout plan. So it's really, for us at a very local level, how things are going, to know in your area what's happening. There isn't one consistent step-by-step plan across the country. As far as who is doing it, again, it depends on the state. So for me here in Arizona, they are setting up large parking lot locations to administer vaccines at a high level. Some states may use their CVS and Walgreens to do things. I mean, it really depends on how your state has determined the most efficient way to get everyone access to vaccines who currently has access. And as far as timeline, it's important to note that, our first responders, our healthcare providers, people living in long-term communities are our priority groups. Kind of the next round are people who do a lot of direct connections with the public, including teachers, and people who have some health complications that may lead to increased risk with COVID. So unfortunately, Alzheimer's is not one of those diseases considered to be something at an increased risk. However, many of our loved ones who do have Alzheimer's or another type of dementia have other health complications that may fall under this category. And so if your loved one is not in a long-term care setting, then they may still be in the access of the next priority group because they have some type of breathing condition. Again, it's checking in specifically with your local level to determine what is it that falls under that category to make sure that if they do have an additional health complication, that they will get it. And we recommend that and of course, age categories have been critically important. So 75 plus, the next group is 65 plus, and that doesn't matter if you have any type of health complication. We do strongly recommend that caregivers get vaccinated as soon as they can as well. Again, it's just the safety for all involved. We know how important vaccines are going to play in addressing COVID-19, and particularly for loved ones in residential and long-term care settings, that it's safe for all.
Yes, so important. And just to remind everyone, like Kinsey said, you want to reach out to your local health department for your state to get that information on how you can get the vaccine or for your loved one. So what is the timeline for somebody who's not living in assisted living? So if I'm an older adult or I have a family member that I'm worried about and they're just living at home, but they're not in a long-term care facility and they want to be vaccinated, is there a way to get in on the early ones?
Yeah, so again, as I mentioned, there is an age component to this. So I know in Arizona, we're already at 1B, and 1B includes 75 plus. And then I think it's 1C, and I can pull that up right away because this is things I've been thinking about a lot lately. And then the next group is 65 plus. But the realities is, important to look at where your municipality and your state is at, and what specific categories that they're covering. I know that there are processes as a part of getting signed up to get vaccines for the general public. So making sure that you're also following the steps to get signed up or kind of registered. I know that's how we do it here in Arizona for people who aren't in kind of those easy special categories of going to a hospital or going to long-term care. If you're a member of the general public, you'll probably have to go online some forms to prove that you are a part of whatever specialty group that it is that they are currently rolling out. So again, keep in touch with your public health departments. Look in advance if you're coming up close to being a member of a category that will count as next. I'm not, you need to look at to see if you do have an underlying health condition that places you as a priority to make sure that you have the documentation you need to ensure that you can get the vaccine as early as you possibly can.
Yes, that's great. So if you've already had the COVID, do you need to be vaccinated?
Yes. Thank you for asking that, actually. Yes, so we suspect that people who've had COVID develop antibodies as a result of it. It's unclear how long, and they're still doing research around this, but currently it's unclear how long you may gain those protections. And even if you had it, it may depend on the severity of the COVID you experienced to even know if you could have sufficiently developed antibodies to make you resistant. So at this point, the CDC is recommending that even if you have had COVID in the past, that you absolutely get the vaccine. It really is tested through clinical trials to ensure that the vaccine will, up to 95% insurance will gain what you need for your body to be able to fight off COVID-19. So you do want to make sure that you go through that. Also, if you were someone who had COVID very early in the process, your body may no longer have any antibodies that could fight off. I mean, the reality is that there isn't clear evidence to say that having had COVID will in fact keep you from getting COVID again. And we have been seeing some cases of people getting COVID twice. So
Yeah.
it's really important to not assume that having had it protects you against getting it.
Yeah, it's a great point. So if you have a loved one who is in a long-term care setting and they have received the vaccine, what are the visitation, are there restrictions or requirements after your loved one's been vaccinated for visiting?
Yes, so I'm going to say the same answer you've probably heard 15 times from me already. But it's important. There's a few things. So one is, again, what is the community or settings process for rollout? What are their plans around visitation? How is that going to evolve? No matter how it evolves, you should still have access to personal protective equipment, rapid testing, and there should be continued safety measures for people even once they've been vaccinated. And there's a couple of reasons for that. One, not people are not mandated, so you have to assume that there's probably a couple of the people who either work or live in the setting your loved one is in who did not get the vaccine. Two, it takes some time to develop immunity even once you've received both vaccinations. And unfortunately, the reality is that the vaccines through the clinical trials have shown to be 95% effective. So we still have to take precaution and be careful, especially as we are still ramping up the number of Americans who have received the vaccine as well. The more and more of us that are vaccinated, the safer it becomes for all. So again, check with with your loved one's providers to see what their process is, if they've made any changes. We're really eager to see those changes in visitation. It is so important. We know how long you have been waiting and how much your loved one needs you, and you need them to be connected. So we're hoping to see some evolution there. It's a bit early to expect that, especially right now. We're just starting to see people who have gotten the second dose. So still, I know it's been hard, a little more patience. And again, they should have a plan of what the expectations, not just and how they're going to roll it out. Certainly access to the vaccine is a factor, right? So if they don't get all the vaccines they had anticipated or had asked for, it's going to delay the process. But they should have some ideas of what they're planning once they've finished the rounds of vaccines in the setting, and then what their next steps are around their policies for permitting visitation.
Well, thank you so much, Kinsey, for answering those frequently asked questions that we've had on the vaccine. And it's been so helpful, I know, to many people who are listening. And if folks want to reach out to you or the Alzheimer's Association, could you share that information of how they can get in touch?
I absolutely can. Thank you so much. So we are available 24/7, 365 days a year through our helpline. It's 1-800-272-3900. Again, 1-800-272-3900. We're happy to ask any of your questions. Again, when it really comes to decisions about whether or not to get the vaccine, we do recommend that you connect with your primary care physician or the physician you trust the most to help you make healthcare decisions, as well as the healthcare provider you trust the most to make decisions with your loved one. So we're great about answering all kinds of questions related to Alzheimer's, but when it comes down to the vaccine specific around decisions of to or not to, again, we strongly recommend that goes directly to your healthcare professional.
Thank you, Kinsey. So we are proud to be a partner with the Alzheimer's Association. And so again, Care Patrol, we're here also to help you finding safer quality senior living and help you with navigate your questions about the vaccine as well. And you can find us at carepatrol.com and simply search on the website which zip code that you're looking in or state, and we have several advisors across the United States who are ready to help you. Our service is free of charge to the families. So thank you again, Kinsey. It's been a pleasure. We love the Alzheimer's Association. We love the level of support and education that you give families, and how much you really give to the community. So we're proud to be that partner and proud to have you with us.
Well, we're certainly proud to have you as a partner as well. And I really thank you for inviting me to speak today. I know that there are so many questions and anxieties around the vaccine, and I'm just glad to help pass some information along to help people make better decisions and feel more informed and know where to go to get the information they need. So I really appreciate it.
Yes, thank you.